Hi everyone, my name is Lisa Pappalardo and I am a heart mom here in St. Louis. I attended the recent A Dose of Magic event, and one of the most engaging presentations was on the topic titled Myths About Sports Restrictions. As a parent of a child with congenital heart disease, my son Grant, it's good to know what boundaries I need to enforce with him, as well as the opportunities for him to get involved with sports. So I'm glad to be joined by Dr. Van Hare, Grant's cardiologist today, as well as Michelle Fink, who's another heart mom, and she has a very active son in sports. Dr. Van Hare is a cardiologist and electrophysiologist here at St. Louis Children's Hospital, and Michelle, just like me, I mentioned, is a heart mom and has Evan. So thank you both for being here today.
Happy to be here.
Thanks for having us.
So we'd also like to thank the Ollie Hinkle Heart Foundation for their partnership with this continuing education series. So thank you for your work in our heart and lung community. One last note before we begin, we're going to be giving away prizes to the first 2 people who submit questions during this discussion. So all you have to do is be one of the first 2 viewers to submit a question, and you can win some awesome prizes from the Heart Center and the Ollie Hinkle Heart Foundation. So we're getting ready to begin. So, Dr. Van Hare, when parents have learned that they are going to have a baby with a congenital heart defect, of course they have hundreds of questions, but one that very often comes up, and I know it came up for us, is, will my child be able to participate in sports? And obviously that's why we're here today, to answer some of those questions, but how do you typically respond to those new parents?
Well, I would say, first of all, that there's all different types of sports and all different types of levels of activity, and so I'm very reassuring that there's going to be a sport for every single kid, no matter how they come through surgery and how their heart is afterwards. We're going to find something that they're going to be able to do. When you have a new baby with a heart problem, your first and foremost concerns is getting through surgery and all of those kinds of things. But when you have a new baby, parents are thinking about decades, and they really trying to visualize what their children are going to be like when they're older, and they have hopes and dreams for their kids, and it's important for us to reassure them that there is going to be lots of stuff that they're going to be able to do. It's going to depend on the heart defect. It's going to depend on how they come through surgery, but there's lots of stuff that they'll be able to do.
Great, thank you. So then, if we're thinking about those years ahead, what age do you really think those heart kiddos can be expected to join in organized sports? And when do you tell parents yes? At what point? What do you like to see before you tell parents yes? And then, Michelle, after this, we'd like to know a little bit about how old Evan was when he started his journey in sports.
So there's no magic number, and I would say that the answer to your question is that it's an ongoing negotiation, as you know, because what kids want to do changes regularly. So I would say we start talking about it when the child starts talking about it, and the discussion is around what do they want to do, and then what are they capable of doing, and what should they avoid doing? And that discussion is going to depend on the exact heart defect and the quality of the heart repair, if there's been a repair, and the function of the heart. And there's a bunch of different kind of factors that go into it. But sports range from everything from golf up through triathlon and everything in between. Different sports have different types of activities. So some sports have a lot of what we call a high static component, which means the kind of stuff where you're straining, so weightlifting, wrestling, and things like that. Those types of things, we get a little concerned about that in kids who have very high levels of heart obstruction. And then there's other types of sports that have a high sort of aerobic, or what we call a dynamic component, and those things like marathon running and things like that. And those we get a little bit more concerned with kids who actually have poor heart function. But frankly, most kids with most heart defects are going to be able to do most things, to tell you the honest truth. It's an ongoing discussion. Fortunately, we have tools that we can use to start to sort these things out and give the best possible advice. physical examination, echocardiography, that helps us a lot. And in certain situations, we'll often do an exercise study. Exercise study will tell us about if there's any heart rhythm issues we have to worry about, and will also tell us something about child's actual exercise capacity. So using all those tools, we can actually give you a pretty good idea. I do want to make one point, which I think is really important, which is that for years and years, I think cardiologists have done a disservice to parents and kids by feeling that they should really avoid all types of physical activity. But we know now that a healthy, active lifestyle is important for all of us, no matter how old and no matter what's wrong with our heart. But for kids who have heart disease, it's even more important. And so we have shifted from restricting to, in fact, actively encouraging involvement in sports.
Great. And Michelle, can you tell us a little bit about how old Evan was when he started jumping into his journey with sports?
Well, it's ironic that Dr. Van Heer mentioned that parents used to be told to limit those activities, because when Evan was born with the trilogy of Fallot, and he had a very successful repair at 6 months, but we were told at the time of his repair that he would not participate in many sports, maybe something recreational, nothing probably competitive, and that we should closely monitor those things for him. So we kind of went with that, but we were a really active family. We're a large family, and just were always physically active anyway. And Evan, just from a very young age, started showing just a vast interest in anything that involved running, a ball, throwing, catching. But at the age of 5, he was kind of watching the kids in the neighborhood, kind of looking over the fence, and some kids were playing soccer. And he said, "Mom, I want to do that." And my, no pun intended, my heart dropped. Like, oh, I don't know if he can do all that. I can't be running all the time and whatever. And but I made contact with his cardiologist. We went in, I asked a lot of questions. Probably repeated my questions over and over and over again for assurance. And they said, well, let's look at his heart. We think he can do it. And so he started his journey at 5 with soccer. So, and we kind of went on from there to a lot of different sports for years.
Great. That's great. So, Dr. Van Heer, you addressed a little bit about how different factors of different sports, so amount of cardio required or amount of exertion or potential impact might be there. And you answered a little bit of that for us already. Michelle, what are the things that you thought about with Evan, whether there was more exertion, that kind of thing, that affected him and still affects him today?
I think as a parent of any child that has any sort of medical condition, there is an innate fear that you carry into every day. You just worry about them, but having multiple children, I realized I worry about them all for just different reasons. And so, Evan is a researcher by nature, so he was always the kid that I could talk to about his heart condition, why he had a scar. I probably didn't do the best job when he was young explaining really what it was, because he's come up with some interesting descriptions of how I told him at 4 and 5 what was going on with the scar. But still, we just would inform him. I would encourage him to ask his cardiologist questions. I would inform him to talk to his coaches and try to explain on his own, because as a parent, I really wanted him to not to live in fear, but to look at himself as courageous, and to look at himself as having drive, and to be an advocate for himself. And so he kind of, I've been blessed in the fact that he's kind of owned that. And he does that himself. I talk to coaches too, but he primarily takes the lead at this point. He's 14 now. In terms of his ability at the outset of a sport, he's played a variety. So soccer, baseball, he's a catcher. He plays football. He runs. I'm forgetting some in there somewhere that are recreational. So he's kind of ran the gamut with the sports, but he typically, the conditioning aspect of the beginning of a sport, he is usually at the back of the pack, and he will tell you that. Because those conditioning expectations change from sport to sport, and it's a different variety of things. But he digs pretty deep, and he doesn't like to be last. So he keeps working at it, and he doesn't end there, but he frequently starts there. a little bit more winded sometimes than other kids, but it builds up over time.
So switching gears just a little bit. It seems like every few months in the news, particularly around the summer months, we hear about a kid who's been playing football or lacrosse or whatever, and they have a sudden cardiac event on the field, and often it ends up in the news because it doesn't end well. Can you talk to us a little bit, Dr. Van Heer, about how common this is, and if we need to worry more about these events for our own heart kids?
So it certainly happens. We read about it in the news. I think that the rarity of the event is, in fact, why it ends up in the news. Probably every single one of these end up in the news, and that will tell you something. And just to be very clear, we're talking about kids who were not known to have heart disease beforehand. We're not talking about kids who've had repaired heart disease. And fortunately, although it's a devastating episode when it happens, it's pretty rare in this country. Probably the best estimates are around 100 per year. And if you figure there's about 4 million kids born in this country per year, it's a pretty low incidence. And, those things are possible, of course, in anybody, including in people who have, congenital heart disease, but the risk is extraordinarily low. And I think it's ironic because if you're a parent of a child who's gone through open heart surgery, your concept of risk has got to be very, very different. You've already gone through something that is much, much scarier, and the complications of heart surgery are much more likely than what you're talking about, which is fortunately extraordinarily rare.
Thank you. So thinking about some of these kids, so some of our kids, like my own son Grant, are doing really, really well, and they've had procedures that they have implanted devices. So in Grant's case, he has a pacemaker. Parents always have questions on how that's different. So what I'm curious about is how your recommendations for those kids and those families might be different. Those questions might be, can my child's heart rate go fast enough if they're swimming or if they're running or doing track? Or, what kind of impact can they take? And if, what kind of protection they can use? Can they pad their chests or pad their abdomens or their shoulders better to be on the field with friends?
Yeah. So, one of the expressions I like to use is that childhood is a contact sport, so you can worry about what happens on the field, but then they're swinging from the bars in the backyard or doing whatever they do, and all of that. I mean, so stuff like that is going to happen to any kid, right? And any kid with a pacemaker. I think there's two things. First of all, and it's more of a general issue. It's not just limited to pacemakers, but there's an expectation issue, which is that if your heart's abnormal, we may not restrict you from sports, but we may tell you you don't expect that your child is going to be at the very top of the pack. They may end up there, for sure, but as you talked about, they do sometimes have some limitations. And that when your heart is being paced, often it doesn't work quite as well as if it's not being paced. And so there's that expectation issue. But then, this is hardware, and hardware can break. And so my major concern is that we don't do things that expose the hardware to unnecessary risks of damage. And so while anybody can get, a blow to the chest or to the abdomen, depending on where your device is, if you're involved in a sport where blows to the chest are part of the sport, then I get a little bit nervous. So the way I sort of think about it is, if you're playing baseball, I think that's great. I might ask you not to be the catcher, because then you're a target, and the ball's coming your way every time. But it's possible you may get into a collision. It's possible you may get hit by a ball at some point. But that's more like just general life, if you know what I mean. Other sports where that's an issue, of course, full contact, tackle football would be of concern. A little bit in terms of wrestling, I think. And I always used to think hockey, because I watch hockey and they seem to hit each other with sticks and stuff like that. But my Canadian colleagues are adamant that they let their pacemaker patients play hockey. So, it's a cultural thing.
We'll talk more about hockey soon. Okay, so, Michelle, can you talk just a little bit about Evan? He's played some high contact sports, and how have you felt about that, and how's that worked for him? And
yeah, so Evan, obviously he doesn't have an implanted device, so there's not that consideration. And his first sport that I consider to be pretty risky really was, he wanted to be a catcher for baseball, Yadier Molina. And so that's what he wanted to do, and that terrified me, right? And so, and that was about when he was in, I think, 5th grade. And so I talked to Dr. Lee, and and Evan wasn't gonna take that concern from me, but he would take it from her, right, his cardiologist. And she said, okay, well, let's just talk about this. And so we had a specially suited chest protector that went underneath his regular chest protector. And she kind of joked with him, and she said, practice at home a lot because you need to be really good. Meaning not miss the ball. So anyway, but he took that to heart too, and but it was concerning. I'm not gonna lie about that. But he grew to love it, and he still loves that position. My biggest fear and highest anxiety was football. And yes, it was about blows to the chest, but it's really about that bigger issue of just football. And we're hearing about it all over the media and what and the injuries. I have been pleasantly surprised that there are more and more coaches and organizations moving towards safer ways and to handle that sport and better choices and concussions and how they look at children for those. But that is, by far, it is his number one sport. That is his favorite. And every time he goes on the field, I get nervous. But he conditions a lot to be prepared, and he's very, very logical and logistic about the tackles and what he's supposed to do. So I sit in the stands and I'm nervous like every other parent, right? But it's working out so far, so hopefully.
Okay. So just thinking about some of these kids that have been advised not to play a sport, a specific sport or a team sport, either due to a complex repair or an implanted device. And I think one of the biggest challenges is that a lot of those kids, as opposed to missing the sport, they really miss the camaraderie. So they really miss the idea of being part of a team, particularly in sport. What would you advise those kids and those parents when it comes down to that, if they really truly can't do something that's part of a broader team?
I think there's, depending on the sport, there's often, roles that don't involve, playing the sport on the field, manager or equipment manager, or, various things that you can actually do for the team and basically be part of the team. I've had a number of patients who've actually pursued that, and I've been pretty happy with it.
Well, and I think the world of sports has really opened up for kids. It used to be certain sports were what everyone did. Basketball,
sure,
baseball, soccer, and now it's wide open. I mean, at my kids' school, they have a bass fishing team, right? And so, and they love it, but it's that camaraderie. It's that feeling like, I can still be unique, but I can fit in and I can make friends. There's a bowling team. There's all kinds of things that I think used to not. They weren't sports that the school supported or even recreationally available to people. So I think that's exciting for kids. They can find something lifelong that doesn't fit a certain mold.
Yeah, I agree, and I think it does bring up the comment that talk to your cardiologist and talk to them about what your child wants to do. There actually are very helpful guidelines put out by the American College of Cardiology and the American Heart Association on the types of sports that kids with various different types of heart problems should be allowed to do, and and those were revised recently to make it much more permissive. Be surprised at the number of things that most kids are actually going to be able to do.
Okay, so the Olympics just finished, and everyone watched Shaun White. And can we talk about him for just a second? I think he was a TET repair, actually, tetralogy. So would you let your son, if he had been, well, if he wanted to go to the Olympics and go 15 feet in the air, would you have let your child do this?
Well, once they turned 18, yeah. Before then, I don't know. The concern would be the heart, put it that way. The concern would be 15 feet in the air and, how good's that helmet and, and how's your neck going to do and all that stuff. I mean, I guess the point is for a lot of these things, the heart's actually not the major concern. And as you said, you're sitting in the stands worrying like every other family member. And most of the rest of them presumably don't have kids with heart problems. Mm-hmm. So I'm not sure what I would do. There's a thing that happens when you're a parent. I mean, you want to help your kid do what they want to do. Right. That's what you want to do. And sometimes it becomes a negotiation.
Mm-hmm. I think too, like you have to weigh, or at least I've had to weigh for myself, like are my emotions holding any of my kids back? And what do I need to do? Because as a parent, you're guarded, you're charged with taking care of them and keeping them safe. And that's, but every parent's scared, every parent's worried. But sometimes I would sit back and I would think, if I say no, even though the doctors have said it's okay, or if I say no, even though it's something he mostly wants to do, is his level of, I wish I would have, been greater than the risk? And so for our family, that's been kind of our guiding principle, is get the information, decide what he's passionate about and understand the risk factors, inform him, talk to coaches, and go with it.
Okay. How about you, if you had been Sean's mom?
That's terrifying to me, but he's amazing though, and Evan's very excited actually that he has tetralogy of Fallot. He didn't know that until the night at the Magic House, so he's very excited about that. We've done a lot of research on Sean White.
So, do we have any questions from our audience coming up? Okay. Okay, we have our first question. Can having a direct hit to the chest affect my son's heart? He had his VSD repair in January, and last July his WPW, so Wolff Parkinson White, was ablated. Does he need to wear a chest plate or protection?
I guess that question's for me.
Probably.
So direct blows to the chest. So assuming without a pacemaker, the sternotomy, which is basically the scar, and once it's well healed, is actually very, very strong. And so there's really not a lot of additional risk, for kids who actually had heart surgery over and above just the general population. That then raises, though, the issue of direct blows to the chest with sports with any child. And you may or may not have heard, but there is this, fortunately, very rare problem, which is called commotio cordis, which is where you get a direct blow to the chest at a critical time in the cardiac cycle that can actually cause a very dangerous arrhythmia. And so there are people that believe that kids of a certain age should actually wear chest protectors when they're playing hardball, and other things that are sort of like that, like hockey and things like that. I don't want to really get into that discussion. It's very, very rare in adults. It's mainly an issue when kids are a little bit younger, when their chests are a little bit thinner and the heart's a little more exposed. But it's not associated in any way, as far as I know, with congenital heart disease issues and heart surgery.
Thank you. So I think we've got some more questions. So Liz Tabaka asks, do you ever have high school parents who have a son or daughter who grew up with a heart defect speak to parents of young patients? Or is there a support group online that the hospital sponsors? That's a great question. I mean, as far as I know, and what we've had is just, I know quite a bit of parent discussion that's more social media based, but is there anything that you know of, Dr. Van Heer, through St. Louis Children's Hospital that's a support group that is still around? I know at one point we had one parents would meet, but we don't do that as much anymore.
Yeah, there's a few support groups for parents with kids with congenital heart disease, and the one that you're talking about, I'm actually not up to date in terms of the last time that they met, but there's a lot of interest in doing that and supporting those groups, and certainly our heart center has been talking about that.
Okay. Yeah, I know they're mostly social media based, and we can always circle back and perhaps answer those questions online.
I know Evan has talked about Camp Rhythm a lot. He loves Camp Rhythm, a camp for children with congenital heart defects, and that place has been a huge confidence builder for him. But I mean, he talked to older kids there about different sports, even one in particular before he ever talked to me. Just because they were active and they were swimming and they were active in it, and he was talking to them about it. And so, but that has been a very empowering place for kids with congenital heart defects because everyone has a scar, everyone has a story. So not a support group for parents per se, but I know the kids can kind of talk to each other and feel connected. And they have, a program for the littles that are just a day program, and then they have the overnight program for the older kids. So.
I know that's been pretty amazing for Grant too. It's been a huge very positive force for him going to Camp Rhythm, and he's already counting down the days and reminded me that I needed to sign him up this week. So.
Yeah, great.
Looks like we've got some more questions. So from Laura Moore-Bohan, should my child wear a heart rate monitor? His heart rate gets so high, he has tetralogy of Fallot.
So I guess you're talking about a heart rate, not a medical heart rate monitor, but like an Apple Watch or something like that is really what you're talking about. I would encourage you to have that discussion with your cardiologist. We didn't touch on this, but kids who've had repaired congenital heart disease do sometimes, in fact, have heart rhythm disorders as a consequence, and those heart rhythm disorders can appear much later, 10, 20, 30 years later. And so if there are episodes of rapid heartbeat, that ought to get evaluated, and we have ways of doing that with these little sort of cardiac event monitors that we can give, and doing other things like that. On the other hand, if the issue is just that your perception is that the heart rate is higher than you expect it to be with sports, that's something we can evaluate as well.
That could be part of maybe that exercise study that you had talked about?
That's one way. Okay. If the complaint is the heart rate goes fast when they exercise, we'll either give them a 24-hour Holter monitor and let them go out and do it, or run them on our treadmill and just sort of see what happens and, compare notes with the family. And a lot of times it's just reassurance. It's just like, no, that's actually how fast his heart's supposed to go. Don't worry about it.
Okay.
A lot of what we do is give people permission to not worry about stuff.
So Jean Garcia asks, is it advisable to let young kids give a sport a try as long as they're allowed to self-limit and rest or participate as needed? And I might add, too, that would probably even make sense in PE and things like that as well, not just even with sports.
Yeah, again, that's, it's specific to the particular heart defect and the particular sport. But, I think just on a general parental point of view, you probably give sports a try, right? Because they may not like it. They may find they don't really do as well as they'd like to do on it or something like that. But I said before, it's an ongoing negotiation, and this is basically part of it. So yeah, I would agree that would be advisable. The self-limiting issue is also, I think, an important feature, and we didn't really get into that in a lot of detail. You sort of talked about it a little bit about your son, but I think that for certain kinds of heart defects, we would say, this sport is just fine, or this type of physical activity is just fine, as long as they're allowed to stop when they feel like they can't go any farther, or they really aren't doing well. And that's this perception that if the kids are pushed well beyond their limits for certain kinds of heart defects, that actually may raise the risk.
Good to know. Well, it looks like we don't have any more questions. So I'd like to thank Michelle and Dr. Van Heer, both of you, for joining us today. Thank you for tuning in. And remember, this discussion is going to be on our video section shortly after we finish streaming today. So always feel free to leave us a comment if you have a question or concern, and someone from the Heart Center will definitely get back to you. So mark your calendars for our next Facebook Live discussion. It's going to be March 28th, where we'll be talking about pulmonary hypertension with, I think, Mark Grady. I think that's who we talked about. And thanks again, and we'll see you next time.